work with Dr. Barrett, is that right?
Barrett, yes.
And what was the diagnosis of your condition?
It's what's called osteoarthritis, to where all the cartilage in my right hip was gone.
So what kind of symptoms and things did you have before surgery?
I limped very noticeably and would have occasional aching down in my hip, and had that basically for over 2 years.
Okay.
And woke up one day and decided I had to do something about this.
Mm-hmm. What was that main factor that made you decide that? Was it just waking up in pain, or?
No, I had been limping around like an old man for so long that I just decided I can't do this.
Done with it.
I just got to get it fixed.
Mm-hmm. Was the pain more noticeable, like at any particular time of day, or was it just constant?
It wasn't even constant. I mean, there would be times where if I sat on it in the wrong, lean like this or something, that I would feel more aching at times. Mm-hmm. But I didn't really have that much pain. Mm-hmm. At least either that or my body was conditioned to it.
Mm-hmm. Did you have any other surgeries in the past on your hip, or was this the first?
No, this was the first one.
Okay. So what procedure did he do for you?
He did a total replacement on my right side.
Okay. And when did you have that procedure?
August 19th.
August 19th of this year?
Yes.
So after surgery, that was in August. We're here in October now.
Yes.
What's the difference between prior to surgery and today?
Night and day.
Really?
Night and day. I mean, I just felt like a brand new person from the moment I woke up after surgery. I mean, it was frankly unbelievable. In fact, even I think the hospital staff was kind of surprised, because I got up probably 2 to 3 hours after I got back to my room and got my walker and I walked right out to the reception desk out on the floor, and they said, well, you better not push it too much. Mm-hmm. Okay, I said, but I feel fantastic. I feel great. So the next morning, the physical therapist came in. I got up, and she and I walked around the entire wing of the joint center. I mean, we walked all over.
Wow.
And they had a little stairway in the therapy room, and I went up and down that without any problem with that. And she said, well, you obviously don't need any help in getting around. And at that point, I was even able to get out of bed pretty easily and to use the washroom. And she said, you obviously, I guess, are what are called independent. Mm-hmm. I didn't need any assistance from anybody to get up and walk around. And I got up. Even after the therapist was gone, I'd get up and walk around myself. Oh. And I had no pain from the time that I woke up.
Fantastic. That's incredible.
Very unusual, I guess. Yeah. I mean, for me, I just wasn't surprised, but I guess everybody else was.
Mm-hmm. So, as far as your recovery period, you're talking a very short period of time for you. Like,
I was on my walker for roughly 2 days after I left the hospital. Cane for another 2 days, and I was pretty much walking unassisted in less than a week after I got out.
That's amazing. And you suffered for 2 years prior to just really having a hard time walking.
Yes.
Wow.
And I guess, I don't know whether it was just a fear of having the surgery or what, and I guess naively I thought that maybe somehow this could get better.
Mm-hmm.
Doesn't happen.
Right.
It doesn't happen. So
what was your experience with Dr. Barrett and his staff as far as, leading up to the surgery and all of that?
It was as the best it could be. They explained what was going to happen and how everything was going to work at the hospital and the procedure, and was given exercises that I had to do after I got out of the hospital. And I knew about all of that going in. They explained how the anesthetist will come in and talk about the type of anesthesia that I would be given, and the possible effects of that. And as I say, it couldn't have been better.
Fabulous. That's wonderful. What kind of activities are you able to do now that you weren't before?
Golf.
Good.
I mean, pretty much anything that I have tried, I've been able to do.
Great.
I haven't tried doing any heavy lifting, but I figured I'd wait with that.
Sure.
But in fact, even right after my 6-week checkup, I asked Dr. Barrett if I could go try playing some golf. Sure, he says, you'll know the limitation if you can't do it. You'll feel it and know that you shouldn't do it.
Right.
Well, I didn't have any problem with that at all.
Fabulous. Great.
It's just couldn't have gone better.
Would you recommend others to Proliance Orthopedic Associates?
Absolutely.
Absolutely.
Absolutely. In fact, I have taken several of Dr. Barrett's cards with me, and because I have gotten to a point now where I recognize people that walk the way I used to, and even though I don't necessarily force myself on them, but if we get into a conversation about it, I certainly am not hesitant to refer them to Dr. Barrett and give them a card. In fact, I've got a fellow at work that I work with that came and sought me out because he's having trouble with his hip.
Wow.
And I said, well, you should go see Dr. Barrett. And because, in my opinion, he's the best.
What brought you to Proliance Orthopedics to begin with?
Well, I'm originally from Chicago. Came out here, call it 4.5 years ago, and it had my knee operated on back there by Wayne Goldstein. And that went really well as well. And when I first started having problems with my hip, I originally thought that maybe it was my knee, because my knee ached a lot more than my hip did. So when we went back to visit one time in Chicago, I made an appointment with Dr. Goldstein, went in to see him, and he checked my knee out, and he said, there's no problem with your knee other than you've got some torn ligaments in there. And he said, I hate to tell you this, but the older you get, those things happen, and there's just nothing you can really do to fix it. You just kind of live with it, put ice on it when it hurts and that kind of thing. But he says, and I said, well, I'm now out in Seattle, and do you know by chance of anyone that I could go see out in Seattle that in the event that this gets worse? And he said, oh yeah. He says, I worked with Dr. Barrett on a knee replacement, and I would highly recommend that you go see him. He says, I would go to him if I had a problem and I was there. I would go to him. Well, that's good enough for me.
That's a strong recommendation.
That's good enough for me. And as it turned out, obviously it was even better, I guess, than I hoped for.
Very good. I'm happy to hear that. What would you tell, well, I guess you've already talked to your co-workers, but friends, family members, basically the same thing if they were suffering from the same condition?
Oh, absolutely. In fact, they have been amazed as well as to, as I say, it's within a week of walking around, and they just can't believe it. I was back to work in 2 weeks, and I probably could have gotten back sooner, except that it was Labor Day weekend. And I thought, well, I'll just wait an extra couple of days and go back after that.
Sure. Fabulous.
And even no one could believe I was just walking normally and still do.
That's fantastic.
Like, never had a problem.
Very good.
So I don't know whether I'm unique or not, but I'd like to think that I'm not because of him. But even my incision is healed very quickly. And even my wife took a look at that and she said, I can't believe how well that has healed.
Yeah.
And no pain. I didn't take one pain pill from the time I left the hospital.
Wow.
Not one.
Wow.
As I say, in my opinion, his knowledge and skill as a surgeon are just above reproach. And I can't say enough. He's made me into a new person. I mean, I'm sure that he may hear that fairly often. But as I say, I think the hospital staff, I'd get up during the day and just walk around. Don't overdo it, don't overdo it. But I feel great.
Yeah.
I'm not overdoing it.
Right.
I just feel good.
Yeah. It's a wonderful thing to feel, isn't it?
It is.
Yeah.
Very thankful that it all came together the way it did.
Mm-hmm.
Even at my 10-day checkup, I just walked right into the office to one of his assistants. And so he can see you're not having any trouble getting around or doing anything. So, nope, I'm not.
Fantastic.
I was very thankful that I was put together with Dr. Barrett, and he made me into a new person.
That's great.
And as I say, I'm sure that things from here will only continue to get better. So I'm glad to sit down and tell you about it.
Thank you so much for the interview. It's wonderful to hear these stories. It makes my day to hear them.